Okay, this is part 2 of the PowerPoint on posture. We've already discussed the first 2 pictures on the slide, so we're going to discuss the one on the right. This shows how dominance affects posture. This person is left-hand dominant, so therefore the left shoulder is lower than the right shoulder, and the left hip is higher than the right hip. Now we will discuss scoliosis. Scoliosis is lateral curvature of the spine. It may be a C curve or an S curve. The C curve means that there's only a curve in one portion of the spine. It could be either a thoracic curve or a lumbar curve. An S curve is a rotolateral curve, and it involves the thoracic and the lumbar spine. So it could be either a right thoracic, left lumbar curve, or a left thoracic, right lumbar curve. This picture shows a right thoracic, left lumbar curve. There are 2 types of curves. There's a functional curve, which is non-structural and flexible and can be corrected. And there's a structural curve, which is fixed and cannot be corrected with position changes. So I'll discuss this now. A functional curve is non-structural, it is flexible, and it can be corrected with lateral bending of the spine. Usually causes for this are leg length discrepancies, muscle imbalances, or poor posture. Structural curves are neuromuscular curves, and they cannot be corrected with any change in position. The causes can be either developmental or degenerative. Developmental curves could be from a disability such as cerebral palsy, which does cause muscle imbalances, or it can occur idiopathically in adolescence, especially between the ages of 10 and 13. Girls have a greater chance of developing a curve of greater than 30 degrees, and surgery is indicated if the curve is greater than 40 degrees. A degenerative curve is due to aging and due to changes in osteophyte formation, bone demineralization, and disc herniation. So now we'll talk about the general descriptions of spinal curves. So you can see in this picture there's a normal spinal curve, which does have a certain amount of kyphosis and a certain amount of lordosis. The second picture shows kyphosis, so that you can see that the thoracic curve is exaggerated. The third picture shows lordosis, where the lumbar curve is exaggerated. And the fourth picture shows scoliosis, which is the lateral curvature of the spine, which we just talked about. Now, Kendall, who wrote a kinesiology book, which is used by many programs, talks about types of impaired posture. The types are kyphosis lordosis, which you can see on the left, sway back, and flat back. So we're going to go through each one individually, one at a time. The first one we're going to talk about is the kyphotic lordotic posture. Here you see an increased lumbar lordosis, increased thoracic kyphosis, an anterior pelvic tilt, and a forward head. And what happens with this is that the neck flexors, the upper back erector spinae muscles, and the external oblique muscles become elongated and weak. The hamstrings are slightly elongated, but they may or may not be weak. The rectus abdominis may not be elongated because the depressed position of the chest offsets the effect of the anterior pelvic tilt. The hip flexors are shortened in a sitting and standing position. The low back muscles may or may not be tight, but the back may flatten in the sitting position. The neck extensors and the hip flexors are short and strong. The low back is strong, but may or may not develop shortness. Here's just a picture of lumbar lordosis, so you can see how the anterior abdominals are weak the hamstrings are somewhat elongated, but they may or may not be weak, and low back and hip flexors are short and strong. Now the flat back posture is the second postural deviation. Here there's a decreased lumbar lordosis, posterior pelvic tilt, hip and knee hyperextension, elongated and weak one joint flexors, such as iliopsoas, and short and strong hamstrings. There's a decreased, the elongated and weak one joint hip flexors are present in flat back posture. The hamstrings are short and strong. Frequently the abdominals are strong, and although the back muscles are slightly elongated, they may not be weak. Sometimes the knees are slightly flexed, but sometimes they are slightly hyperextended. Now the third postural deviation is sway back. Here you see decreased lumbar lordosis, a posterior pelvic tilt, hips are anterior to the humeral head and lateral malleoli, and the head is forward. We may see hyperextension of the knee, increased thoracic kyphosis, and abductor scapula with sway back. So now we're going to talk about examination of posture. What we need to look at as a therapist is you need to look at the patient's histories, you need to do tests and measures, you need to look at the PT's evaluation, diagnosis, and prognosis, and then work on an intervention. So we will go into these in a little bit of detail right now. What's included in the patient history are the symptoms, such as pain, lack of function, that kind of thing, functional abilities, current and past, and their posture. This is the first component of tests and measures for most of your patients, and it needs to be evaluated relative to postural alignment. You need to also look at joint positions and motions. You want to look at rotation around a longitudinal axis. You need to look at the tilt in terms of the head, pelvis, and the scapula. You need to look at protraction and retraction of the scapula, and also look at how this affects the sternoclavicular joint. You need to look at scapular elevation and depression. You need to look at gliding motion of the scapula. Is the scapula flat, sliding in a flat or a slightly curved surface relative to the ribs? The spinal position is critical to examination of posture. So you're going to look at lordosis, kyphosis, and scoliosis. Other things you're going to look at in terms of posture are the ankle. When the person is standing, the ankle should be in 0 degrees of dorsiflexion and plantar flexion. From a lateral view, the line of reference should pass just anterior to the lateral malleolus, as I talked about before. And you need to look at the knee, the hip, the pelvis, the shoulder, and the spine. This slide describes tests and measures that can be used when you look at posture. You can look at the list here. For you this week, you're going to be using a postural grid. You're going to be observing the patient. We will practice palpation of bony landmarks so that you can actually assess symmetry between the sides. We're going to use a plumb line with the postural grid so that you can look at posture. And there are other things that you can use, but this is what we will be using this week. The plumb line will be your line of reference, and it'll show the effects of the force of gravity. And the base should be the point of reference for the patient, but sometimes when you're trying to align your classmate with the plumb line, if you put the bottom of the plumb line just anterior to the lateral malleolus, the rest of the person's going to be totally out of alignment. So what you may have to do is realign the person so that the majority of the plumb line goes through the landmarks that you're looking at. Okay, this PowerPoint slide will give you some YouTubes that you should look at because it shows you how to assess postural alignment, and you need to do that before Tuesday's lab. In the future, we're going to be looking at range of motion and manual muscle testing. You aren't familiar with this yet, but we'll work on this later. And then after that, usually the therapist provides the PT diagnosis and prognosis, but just as information, the preferred practice pattern for a postural problem that you may be working with the patient is practice pattern 4B, which is impaired posture. Some of the factors that affect whether a person is going to get better or not are age, the length of time that the patient has had the postural impairment, any pre-existing conditions or diseases, and whether the patient is going to adhere to the physical therapy exercises and the intervention that are given by the therapist. In the long run, you may see some impairments that are due to poor postural alignment. You may see weakness or imbalance of muscles. The patient may have pain. They may show decreased range of motion. They may have decreased leg length discrepancies, or they may have poor or unbalanced respiratory function. Then in terms of functional limitations of people with postural problems, you may see self-care difficulties, difficulties in home management, problems with work, which includes job, school, and play, and problems with community and leisure. In the lab, we will look at postural analysis. So I will now stop this talk, and we will work on this in the lab. I hope this was informative to you.